Hi, my name is Jocelyn and I'm a South African physio, currently living and working in Dubai, coming up to 3 years here. I focus on treating scar tissue and also the abdominal organs, but today we'll talk about the scar tissue, less about the viscera. I see a lot of mastectomy patients here. Despite having a younger population than elsewhere in the world, there's still the same incidence of breast cancer, so something maybe needs a bit of research in the future. The typical clinical picture that I see is a woman who's had a bilateral mastectomy, one side prophylactically and the other side as a necessity because of tumors that have been found. And what usually happens is they will do a bilateral reconstruction at the time of original surgery and then do radiation afterwards. I'll typically get a woman coming to me with one side that she's totally fine with, the prophylactic mastectomy side, and the other side, the breast tends to be hard and high and tight and uncomfortable. They often say things like, I don't feel like it's my breast, it feels like I've got a hard melon there, it's not their own tissue and they never accept it fully. So first and most importantly is timing. You cannot work on irradiated tissue too soon after treatment. The tissue is friable, it's delicate, there are so many things going on there, it needs time to settle. So you want to start with working broadly and generally. I always start with the rib cage on the affected side. Right, this is a bearded model. I didn't think that I could show a real breast on something recorded in Dubai, so here you have an unusually manly breast. So just get that rib cage moving before you even touch the breast. Stretch everything else. The rib cage gets totally locked down, so get in under that, move it all around. You want to move it up and down and left and right. Just create some space there, and if you can get it all moving nicely, it should leave the patient feeling a lot more comfortable. So getting it moving in all directions. Again, just get hold of it and move it up and down and side to side, all within the patient's tolerance level. Okay, get that whole thing moving. The skin's going to be tight, the muscle's going to be tight. And what I'm doing here is a technique that I learned from Willem Fourie, also South African. He's talking about lymphatic drainage and also edema prevention. It's actually lifting up the implant slightly and then compressing. So there's the compression and that little bit of lift, gather it up and compress.